Hi, Miss Sarah Jones. My name is Morgan. I'm here to do your cardiac and PV assessment today. How are you? Okay, good, love. Can I please have your name and date of birth? Thank you. Okay, so the cardiac and PV assessment, we're just going to be assessing and listening to your heart sounds and checking vascularity in your extremities. Okay, peripheral extremities. So I'm putting on some sanitizer here. But first, I'm just going to inspect your chest, okay? So when I'm inspecting your chest, I'm checking for color, hair distribution, any lesions, and the chest does seem to be symmetric with the clavicles, the breast, and the sternum. They're all aligned, which is good. Next, we're going to ask the patient to turn their head. And Miss Sarah, if you don't mind just turning your head, I'm just going to check your neck. What I'm looking for, I'm checking for any jugular vein distension. There isn't any, which is good. But to measure, I do have a ruler and I have a pen. And to measure, what we're going to do is we're going to locate that suprasternal notch. We're going to place our ruler vertically down, and we're going to place the paper or the pen at the level exactly where we see the jugular vein extension, and then that should give us the centimeters, our measurement. Mine came up to be 1 centimeter, which is normal. That is why there isn't any jugular vein extension, which is good. So next, we're gonna have our patient relax their head in the normal position, and then we are just going to auscultate for any bruise in the carotid artery. We're gonna do both sides. We're gonna listen with the bell. Just breathe regular for me. Auscultating the carotid artery on the right side. Now I'm going to go to the left side and auscultate the carotid artery. Okay, there weren't any bruise present when I auscultated or any heart murmurs. So we're going to go ahead and palpate both sides, but one side at a time. Okay, so I'm going to palpate this right carotid artery. Okay, and next I'm going to palpate the left carotid artery. So both arteries on both sides is 2+, and the rhythm is normal. So that's good. Okay, now that we have palpated the carotid arteries, next I am just going to inspect the chest. So I'm uncovering my client just briefly so I can inspect the chest. Once again, for color, there isn't any cyanosis or pallor. There aren't there isn't any hair on my client's chest, but the hair that I do see is the normal hair that um, outlines body, so that is evenly distributed. There aren't any lesions, and once again, the chest is appearing to be symmetrical with the breast aligned with the sternum and clavicle, so that is good. So next, I'm just going to do inspections with my eyes for any heaves or thrills. I'm trying to see any apparent or protruding pulsations. That's what I'm getting at eye level. And I don't see any, which is good. So now um let's feel for pulsations. When I say I don't see any, I'm saying I don't see any abnormal like pounding pulsations. So the pulsations that I see are normal and almost not visible. Next, I'm going to take the palm of my hand and we're just going to palpate for any of these thrills or heaves around the precordium. Okay, so the pulsations that I did feel were very little. Um, you can feel them, but they weren't abnormal or protruding or pounding. So that is good. Next, we can begin to auscultate the heart sound. We're going to be checking for aortic, pulmonic, Erb's point, um, tricuspid, and mitral. And I'm going to be listening with the diaphragm of my stethoscope. So now I'm just going first to the aortic. Going over to the right side for pulmonic. And now I'm going to Herb's point, which is in between pulmonic and tricuspid. And now I'm going down to tricuspid. And I'm going mid-clavicular fifth so I can listen to the mitral heart sound. Okay, all heart sounds appear to be normal. There isn't any abnormal S3s or S4s, and there aren't any heart murmurs or bruits, which is good. Next, gonna cover my client back up and then ask them to turn in the left lateral position so that I can check for the apex. So I can also take the apex of the heart. Listen to that. So that's what I'm gonna go ahead and do now. Checking the apex of the heart with the bell of the stethoscope. Okay, and you can most definitely hear the apex sounds when a person is turning lateral, which is good. Anything isn't abnormal. So now that we have listened to that, next we're going to assess the extremities. First, I'm going to start by just inspecting the extremities for any color abnormality, any cyanosis or pallor that's not there. There aren't any lesions on my clients. And hair distribution is even, and everything is symmetrical. And I'm just going to have my clients to put their fingernails and nail beds together like this so I can check that there isn't any clubbing of the fingers, and there isn't, which is also good. So next we're just going to do inspection. I'm just going to palpate the extremities, palpating the arms for any warm, any abnormal texture like leathery rubber feels. Checking the legs now, just exposing the legs so I can palpate the legs. There aren't any hidden lumps or masses that I'm feeling. Also on the feet. Good. And I'm also checking for edema. I'm going to check for pitting edema. I'm just going to slightly pinch, and there isn't any pitting edema there. Do the same thing on the other arm. That arm is good. And now I am doing the legs, checking for any pitting edema. Not present. Good. Okay, while I'm down here, I'm just going to pinch all the little toes so I can check the capillary refill, and that appears to be normal. And I'm going to do the same on my client's hands and assess capillary refill in the hands. So capillary refill appears to be normal as well. Next, I'm going to just palpate the pulse sites of my patient's extremities. So I'm going to palpate radial, Next, palpating the brachial. Okay, got that. Next, we're going to palpate I'm sorry, not that one. We're going to palpate the femoral, which is down here in the inguinal. Make sure that it's normal. Next, we're going to palpate the um the popliteal post, which is behind the knee, and you want to make sure you get a good grip on that. And then we are going to do our dorsalis medius, which is on the foot. Dorsopedius, and then we're also going to be checking the tibialis back here. And all of those appear to be 2+, except for the popliteal behind the knee. That one, it's there, but it's just slightly diminished because it's so deep. But all pulses are 2+, and they appear to be regular and normal. So now that I have performed my assessment, both assessments, I'm just gonna have my patient dress themselves again, and then I'm gonna place the call light within the bed, put the rails up, and then ask my patient if they have any questions. If they don't have any questions, I'm gonna go to my computer and document my findings and go from there.